Time for another episode of Local Roots. Hi, I'm Todd Studer. Today, we're visiting with Allison Head from the Pottawattamie County Public Health, and we're talking about their shiny new home. It's in Council Bluffs, and if you haven't seen it yet, this building is a big step forward for access and also county-wide support. Allison is going to share how the new space brings teams together under one roof, including WIC, Women, Infants, and Children. And they have more clinic rooms, a larger lobby, and a community conference room that seats, well, close to 50. We're also going to cover who qualifies for services and how families can tap into low or no-cost resources. Also, why this setup makes it easier to get help without the runaround. We're also going to preview a creative event that is tied to the Great American Smokeout. The theme is smoke meats, not butts. And there's also a quick heads up on safe disposal for vape devices and batteries through the recycling center. And then before we wrap up, a community note on the upcoming drug take-back day so you can clear out old medications the right way. All right, grab your coffee, settle in. We have local help, local access, and a local look inside a public health team that serves the entire county. Are you in the market for stylish, locally curated fashion that's close to home? The Unique Boutique Iowa is located in Neola at 101 4th Street, your destination for trendy clothing, accessories, and distinctive gifts. It's owned and styled by Jamie Bush, a Neola mom and former educator. UBI brings a homegrown passion for quality and community to every piece. She's open on the weekends, Saturdays 10 to 2, Sundays 11 to 3, always online. You can go to her website, shopubiowa.com. Browse those new arrivals, graphic tees, denim, and seasonal pieces that are perfect for any occasion. Unique Boutique Iowa, distinctive styles, heartfelt service, right in Neola. And for precision metal fabrication done right, it's Foxco Fabrication. From custom welding to large-scale manufacturing, your ideas are going to come to life with expert craftsmanship and cutting-edge technology. I use Rick and his team for things all the time, and whether you need industrial, commercial, or some custom fabrication with signs or maybe metal etching on mugs and cups, they're going to get the job done on time and built to last. Locally owned, proudly made. Built to perform and made to last. That is foxcofab.com. There's the website. For those driving around Council Bluffs, you may have noticed that Pottawattamie County Public Health has a shiny new building, and boy, it sure looks great. And Allison Head is a community health organizer joining us this morning. Allison, we had spoken at the farmers market once upon a time, and I know that I asked you this question then, but I'm going to ask you again. How's it been in the new building? Because it just looks so great.
It is phenomenal being in this new building. Previously, we had a clinic that we were working out of over on 4th, and it was a very small space. We were all kind of on top of each other, and part of the staff was over in the courthouse because there just wasn't enough office space, and so we were splitting the distance and doing our best to connect with each other. So being in our building, having everything at our fingertips, having our coworkers at our fingertips, it's been a really great experience. We have a conference room on our first floor that can seat up to, I think, 48 people, which has been a fantastic gathering space for trainings for ourselves and for community partners. Our nurses have 4 clinical offices that they can actually work out of now and have that dedicated shiny, new, clean smelling space. You know, everything's, like you said, bright and shiny. And now we have WIC in the office with us. So it's a one-stop shop, and it's been really fantastic.
How has the response been from the folks coming in to utilize the services? And because they were trying to get into a cramped space too. So how has it been for them?
I think really great experience all around. You know, our waiting room is much larger now. We have a brand new bathroom space that before it was a one person bathroom stall. So if there was even 2 people who wanted to wait, and now we have a men and women's space, we have water fountains. I think that it's just a much friendlier experience for them as well.
Yeah, I don't know if you remember, you and I used to be in the same building because I was on the other end running the podcast studios. So occasionally somebody would come walking in there looking for you guys.
Yes.
And I'd say, nope, they're on the other end. Just walk down there. But
walk to the corner.
yeah, right down there. But this is better situation all the way around. And it is allowing you to uh, really focus, I think, a lot more on what the services it is that you're providing. That you don't have to think about, the facility or anything like that. It has to be just kind of like a weight lifted.
Yes. We have a lot of resources that we offer to the public for free or very low cost. And now that, again, that we have the space, we can see exactly what we have. We can stay on top of our ordering so that when someone walks in and they're making a request for those items, we know what we have and can facilitate those needs right away. It's been fantastic.
Who qualifies for your services? What type of folks is it that coming in to see you?
Well, we have a wide range of things. So that's kind of a hard question to answer, but mostly everybody.
Okay.
Okay, okay. I mean, that's kind of the blanket answer there. A few of our services have caveats to them. So, like our immunization nurse, we have free immunizations for like school age children, for example, but they would have to be either underinsured or not insured or Native American, or we have like a veterans program that can help with immunizations for kids. So some of those things have, a few checks that have to be, but like if someone comes in for our Safer Sex program, I mean, you don't have to have an ID, you don't have to have an insurance, you can walk in and we're going to see everybody. We're going to help everybody. So yeah, we're trying to, the whole point is that everyone is going to have an equitable opportunity to be as healthy as they can be in this crazy world that we're living in. So
Yeah, it sounds like you're not designed to replace any type of health care at all.
no,
It's just you are a supplement and an assistance to maybe some areas that are being underserved.
yes. Many of the functions that public health executes is actually grant funded. And so then under those guidelines of the grants, that money has to be put towards very specific purposes. And so what we're offering then to the public, while it is possibly narrowly scoped, it's then provided for free or very, very, very low cost. So
What are some of the programs that you're talking about then? What are some of the things that you are focused on to be able to serve the community and communities? Because it's not just in Council Bluffs.
right. Nope, it's not just Council Bluffs, it's the whole county. And one of our programs, our SPOTS program, actually even reaches out to a couple of our other counties surrounding us. But that is one of our Safer Sex programs. And so we also have an outreach clinic at the college. And when we educate in like the high schools and the middle schools, obviously the science backs up that the only 100% out there, if you're engaging in sexual activities, is to not engage in sexual activities. So if you are, if you're not married or under 18 or not wanting children, the only safe actual thing, the only 100% is don't do it. But we're adults and we make decisions, and this is the real world. And so if you are going to engage in sexual activities, we have safe sex supplies for free. So lubricant, condoms, dental dams, anything like that. So if we can keep someone safe on the front end, then we would love to do that. And if something happens, because again, real world things happen, if we think that there's an exposure of some kind and someone walks in the door and say, hey, I need an STI test, we do that for free. And if a positive test comes back, then we do the treatment for free. And that's because of all the stigma that surrounds sexual health and the hesitation to reach out and get help, when really it can be as simple as saying, hey, I need help. And then if you have a positive test, it's possibly a shot of medicine and it's going to go away. I mean, syphilis, if left untreated, can make a person go blind and can make a person go deaf and can be cured with an antibiotic or maybe I'm not a nurse, so maybe that's an antibiotics, maybe not the right term, but it can be cured with medicine. And it's as simple as that. So we try to remove as many barriers as we can so that people have that access and that confidence to know that they're going to come into a safe, non-judgmental space and receive the help that they need.
Now, you brought up the stigma, and then, of course, you and I visited beforehand. As you're aware, I'm very heavily involved in the mental health part, and sitting on the board for NAMI Southwest Iowa, and volunteering with different things from them. Obviously, stigma a big part of that too. But I think if there's one area where the stigma attached to it may even be more cemented into our society, it's with STIs that you're talking about. It's like that's the stigma attached to that will keep people from going to get help. I mean, it is really, really strong.
Yeah, it is, and it's a scary thing, and it keeps people from talking about it and getting the education. Like chlamydia, you can have it 3 different ways. You can have it obviously internally, you can also have it anally, and you can have it in your mouth and throat. And so even if you're not having sex, if you're engaging in oral sex activities, it's still possible to get an STI and to have those side effects and the health repercussions. And so, we're trying to reduce that stigma, get the education out there, and help people.
Something else that you are working on is a smoking cessation that's coming up. That this is, as you're telling me about it, this sounds pretty darn cool, what it is you're doing.
Yeah. So the state this past year has done a lot of realignment. And so now under behavioral health, under the state, they have our tobacco-free, nicotine-free program. And so one of my other functions is as the tobacco-free tobacco program prevention coordinator. And so the work group that I'm a part of, it's called the Tobacco-Free, Nicotine-Free Work Group. It's just a few of us here in Council Bluffs, and a couple, like Harrison County, we have a couple people who've reached over. We're sharing information and ideas and experiences. But we are actually had an idea that we are going to do an event in conjunction with the Great American Smokeout on November 20th. And we have invited some food trucks here to our public health parking lot. And a few of those trucks have smoked meats. And so we're going to have a smoked meats competition on the Great American Smokeout to encourage people to smoke meats and not butts, and to get that word out and have a community event. And then also we reached out to the community school district, and for lunch that day, they're going to be serving cold turkey sandwiches to the kids. So, I mean, obviously we're hoping that kids aren't smoking, but it's that whole idea of if you quit cold turkey, eat a cold turkey sandwich instead. You know? Yep.
Well, and I think I'm assuming the stats still hold true, because back when I stopped smoking, which is past 16 years ago, everything that I was hearing was that to give yourself the best chance, percentage-wise, of successfully quitting, cold turkey was going to have the highest level of being able to do that. That's what we were told back then. Since I have been out of it, I can't tell you if that's still the same thing, because I'm not looking at those stats anymore. I'm not a smoker anymore.
No, actually, the science has come around to the other side of it, that if a person is able to get a nicotine replacement therapy of some kind, with the kind that works best for them, that they're going to have a higher chance of success at quitting. And it's a hard road. It's it is a drug. I think people forget that because it's a casual drug. It's a legal drug. It's a drug you can see in the grocery store and in the gas station, and people walking down the street engaging in this drug, but it's still a drug. And so any assistance that you can get, it's going to increase the odds of being able to quit. Cold turkey, still possible. Anything you can do. But if you can get something to help aid, the science is showing that there are higher success chances at that.
Well, I am proof that if you're a smoker, you can do it. I promise you that you can. It's going to feel like you can't, but I promise you that you can. And the hard part for me was the realization that I was never going to see the light at the end of the tunnel where this was concerned. The only way that I could measure my progress was by looking behind me and seeing where I was versus where I am now. Because to be honest, with my own human brain, it didn't feel any different. Having been off of it for a few months, it felt like I was, still addicted to cigarettes. But if I'd stop and look back at where I was, then, I have made progress. I'm not feeling this strong urge to smoke nearly as often as I was before. Before it would be, once, maybe more than that per hour, but that faded. And then maybe it faded down to twice a day. And then it would fade down to a couple of times per week. But I wasn't really paying attention to that until I stopped and looked back and said, this is where I was and here's where I am now. And that's the trick, that those things can play in your mind.
Well, even again, it is the trickiest drug. They say that nicotine is one of the most addictive drugs that is out there. And I mean, that is a consideration of all the drugs that we know about, right? And part of that is because of the mental component. I mean, it's changing the way your brain functions, just like all of the other drugs. It's affecting those dopamine receptors, and it's creating the cravings and the addictions and the highs and the lows, just like other drugs. But there's the legal part of it. Okay. So like I said, you can be quitting and walk down the street and then you've got someone using the drug right next to you. It's not quite like, and I'm not to diminish, but not quite quitting like meth or an opioid or something where a lot of that's done in private. You're not going to just walk down the street and then necessarily have it thrown in your face. Again, not diminishing that journey, because that's also challenging. So there's that whole mental, and then because it is socially accepted to a degree, I mean, it's literally built into your daily routine. You're going to smoke on your way to work because you smoke on your way to work. There comes a point where you're not even checking in if you're having the craving. You're getting in your car and you're driving to work, so you light up a cigarette, or you're cooking supper, or it just becomes so absolutely ingrained in your life and in your mental state that it's very hard to quit. And then the other thing is that we know that tobacco is the number one leading cause of preventable death in the United States, but it's a slow killer. And so it's easy to think, well, not me.
Oh, yeah.
I'm not going to get lung cancer or tongue cancer or cheek cancer. I'm not going to have a heart attack or get liver disease. Like it's not going to be me, because it's a long-term killer. And so it's really easy to downplay those effects and to put that addiction on the back burner of your brain because it's not right now.
I remember reading an article back before I'd quit that said, and this is how twisted my brain was at the time. We're talking a lot about quitting smoking here, but it was the article was saying that smokers, if you continue to smoke, you have a 1 in 2 chance of dying of a smoking related illness. And I read that article and my brain said, well, I got a 1 in 2 chance. I like those odds. But to steal a line from a comedian, if you were jumping out of an airplane with a parachute and you were told, hey, you got a 1 in 2 chance that chute's not opening, you're not going. So that was how twisted my brain had gotten, though, because of the addiction to the cigarettes and me personally justifying it over and over. That was just how bad that had gotten. So, what I love about this event that you're talking about is you're having something there for everyone. You're making it appealing for everyone, smokers, non-smokers, and they can get around. If you're a smoker, get around some non-smokers and see how life is that way. We want you over here now. I know it took a long time for me to identify as a non-smoker. I was a smoker who had quit, but eventually I did get there. And now I would never, just couldn't even imagine a situation where I would ever pick those things up again because it was too hard to quit. And I don't want to undo all that work. But this event just sounds like it's going to be such a great time. And you're getting something out there and really encouraging people and making it a fun event.
Yeah, thank you. And I do want to throw out there really fast what I don't, because Big Tobacco is out there advertising their brands out. getting people addicted because that's what they do. They're a business and it's all about their bottom line. Okay. I do want to point out that most people don't know that most of the vape devices and most of the flavors that they are seeing out there in the stores are not FDA approved. They are not legal to be on the shelves to be sold or to be consumed. 38 devices and flavors have been approved. And of those 3 flavors, it's like, for the vape devices, we're talking about like menthol, regular flavor, and maybe one other. I can't remember out off the top of my head, but all those other ones that you're seeing, the ones that are out there attracting the teenagers and the middle schoolers. And I'm sorry to even report 4th and 5th graders are being found with vape devices. Your cookies and cream, your blue raspberry, your peaches, they're out there to get the kids addicted, to make it easier to smoke, to get that consumption. It's not legal. They're not FDA approved, and they're just out there being sold.
Wow, that's I could probably get into. I could probably start a lawsuit on me here by just talking about some of the different stuff I think about that. But
sorry, no, but I get excited about this too. We talked about being passionate and going on a thing. And most people don't know that those things aren't actually disposable. They're described as like, reusable and disposable, and they're not actually. The ion lithium batteries in the vape devices you can't just throw those batteries in the trash. They will start fires. And then the actual pods that the liquid nicotine goes in, it is considered a chemical waste. And so it's not supposed to go in the trash. It is supposed to be disposed of like a chemical. And people don't know that. And so there's all these other earth ramifications we're having. But a shout out to the Council Bluffs Recycling Center. They have gone above and beyond with their certifications so that they will actually accept those items for free if you're within Council Bluffs. So you can go in and dispose of that chemical waste and of those batteries at the Council Bluffs Recycling Center. And they're going to dispose of it the correct way.
That's good news. That
and actually be with us at the smoked meats competition, and they'll have receptacles there. So if anyone wants to come and ditch them that day, easy peasy.
Well, I would also encourage anybody that is thinking about stopping smoking, get a buddy, get somebody to walk this journey with you. And mine was done virtually on a website, but I credit someone who actually originally from Iowa has lived in Louisiana for decades. He was 6 weeks ahead of me on his quit versus mine. And we started chatting and having the common, history of being from Iowa. And what I told myself mentally as I was going through this was, oh, well, he made it another 6 weeks. And he's still here. I can do that too. And I just kind of symbolically hooked my little wagon to his, and we walked through that journey until we got through it. And yeah, get a buddy and do it together and hold each other accountable, because sometimes you need the little extra boost that you don't have it in yourself, the willpower in yourself, but you can lean on somebody else and you say, okay, well, I'm not feeling like not disappointing myself today, but I don't want to disappoint this person who I'm walking with. And that it's a big, big psychological help.
Yes. Again, it's that support. Any way that you can get it is going to increase your chances.
Before we wrap things up today, Allison, tell me a little bit about your why. Why do you do what you do? Why do you work where you work and help the folks that you do? What is it behind it for you?
So I've taken a long journey in life. I actually went to college for musical theater. I lived in New York City and was doing musical theater professionally. I was a restaurant manager out there for one of Anthony Bourdain's restaurants. I moved back to the Midwest. I was a personal trainer, taught classes. Then the next thing, I was a detention officer at the Pottawattamie County Jail. And then, I worked for city government. I worked for the city of Council Bluffs, and now I'm here at public health. So I've taken a long, winding path to get here. But I think the thing that has always held true for me as an individual is that I want to help people. I want to include people, and I want to make people happy. And so my job as the community health organizer is to make those connections with the public, to share what we're doing, and to talk about the resources that we have, because again, much of what we have is grant funded. And so we have to use it in certain ways. We're not just out there throwing money around for like advertising and stuff like that. So we have to connect with the public on an actual like personal level. And we go out there and we're at events seeing them. We want their feedback. We want their perceptions. We want to know how we can help them, and we want to share how we can help them. And then knowing that they're important. Like I said, it's a crazy world out there I'm not going to talk to it, but it's a crazy world out there. And
It
if
is.
we can make people feel safe in any capacity, feel cared about in any capacity, feel seen in any capacity, then we want to do that.
You're doing wonderful work, and for some reason, what you just said made something else pop into my mind. Something that I'd heard maybe just about a month ago. That regardless of how smart I feel that I am, every single person walking the planet has more information about something that I do. Everyone. They have something that they know more about than me. So it's a learning. You could learn from every single person that's out there. And I don't know, it's like a one-off from what you're just talking about, but still what you said just reminded me of that. And because everybody's valuable. We want everybody here, and we want to make sure that everybody has access to healthcare. So thank you so much for what you're doing. Thanks for your time today. I'm hoping that it wasn't too terribly uncomfortable for you.
Can I throw one more thing at you?
You bet.
On Saturday, October 25th, another one of the coalitions that I'm working with, Prevention Means Progress, they're participating in a drug take back, the National Drug Take Back. And so at the Walgreens over here on East Broadway, I think it's 535,
I think. Yeah.
They're doing their drug take back. So from it's either 10 to 2 or 10 to 3, you can show up, and any prescription drugs. And again, Council Bluffs Recycling is going to be there. So if they want to drop off vape devices or those empty pods or whatever, that's a great opportunity to do that. For lots of reasons, people might be getting rid of drugs, but it's better than throwing it into down the sink or in the trash. But if you have like a loved one who's passed or a prescription you don't use anymore, it's a great time to get rid of those old prescriptions out of your cabinet so that they're not being used the wrong way or affecting, anything.
Yeah, it doesn't matter how old they are. You don't know what the strength is. You don't know anything about it. It's best just to get rid of it this way. So, Grant, you said 25th?
Yes, Saturday, October 25th.
Okay. All right.
And while the pharmacies have Narcan available, they usually charge for them. If anyone ever needs Narcan for any reason, if they think there might be an environment where someone might take a pill that's not theirs, prescribed by a doctor, or a situation where something might be consumed, here at the public health, we always have Narcan available for free.
That's perfect. Allison Head, she is the community health organizer for Pottawattamie County Public Health. Thanks for your time, and hope to see you back on the show again soon.
Thank you. Thank you so much.
Coming up soon, we're going to get some more insurance tips from Travis Castle with Castle & Associates of American Family Insurance. They are your local insurance provider for all of your home, auto, life, business, and farm insurance needs. They have locations, 4 different offices. They're in Trainer, they're in Council Bluffs, and then across the river, they're in Bellevue and in Elkhorn, which means they're local and in your neighborhood, ready to help you navigate the complexities of insurance today. Travis and his team will educate, advise, and simplify insurance, all to protect those things you cherish most. Give them a call for your free quote. And Service Master Restore by Schmader knows it can be hard to get back to normal after you've suffered serious property damage due to flooding, fire, or smoke, and you may also be left with all sorts of questions about how to get your home or business back to normal. Service Master Restore by Schmader will restore your space by offering quality commercial and residential restoration services all around Southwest Iowa. Give Cindy a call, 402-339-9911. That wraps up today's show. Again, thank you to Allison Head from the Pottawattamie County Health, and we are looking forward to that great event. Smoke Meats Not Butts with the Great American Smokeout. Doesn't that sound like a lot of fun? Let's get out and support that. My name is Todd Studer. We'll see you back here tomorrow morning.